Hello, today is Saturday, April 6th, 2019. My name is Sarah McLeod. I'm your host for Proven Cures, and today's video is actually being done based on a request from a subscriber who wanted me to do some research on alternative therapy for the occurrence of thyroid nodules. I'm not sure if this person is a man or a woman, so I don't want to use the wrong pronoun in addressing that person. I'm not sure if this person is suffering from recurring thyroid nodules. Maybe he or she had surgery already and doesn't want to have a lifetime dependence upon thyroid medication, or maybe they know a sufferer. But whenever I'm asked to do research on a specific subject, I think this person, is probably in dire need and needs some help or needs some advice. In addition to that, I want to say that a lot of times when I do my research, if I am not able to find, if I'm not able to find a definitive dosage of treatment or frequency of treatment, like if I'm not able to say, well, take this amount of something this amount of times per day and expect results in this amount of time, I normally don't share whatever I've researched. I don't share what I found out because I feel like it's not definitive enough to have a stranger embark on that protocol. But when I'm asked specifically for help, this is not information that I found out on my own or I decided to just research off the top of my head, then I go the extra mile. And that's what I did here. So it was really hard for me. It took quite a few days for me to find information on thyroid nodule research. Most of the data that's published is cancer related, but the fact of the matter is that at least 90% of thyroid nodules are in fact benign, and people who have them obliterated by surgery are then put on a lifetime of pharmaceutical therapy in order to prevent their recurrence. And I can understand why they would want to have an alternative. The study that I found was actually conducted in South Asia, where the participants were selected from a population that has an endemic suffering of goiter, hyperthyroidism, and thyroid nodule problems. The title of the study, I'm actually reading from my other phone, so if you see me going up, looking up and down, that's what I'm doing. The title of the study is Turmeric Use is associated with Reduced Goitrogenesis. Goitrogenesis meaning the development of goiter. Thyroid Disorder Prevalence in Pakistan. It's called the ThyPAC study. It was published between May and June. I believe there was an addendum to this study published in June, but the original publication was in May of 2015. The study was conducted at the Department of Medicine and Allama Iqbal Medical College in Pakistan and the Department of Clinical Research at the Pakistan Cancer Care Welfare Society, also in Pakistan. The researchers are Ali Jawad, Saeed Hunain Riaz, Mohammed Zaman Khan Asir, Abdul Wahid Chowdhury, Muhammad Zakaria, and Javed Akram. Okay? And the population of participants was 2,335 residents, out of which 669 had hyperthyroidism and an occurrence of palpable goiter, which is indicative of presence of thyroid nodules. This was more of an observational study, and it was found that the population who did not present with nodules had a different diet from the population who did. Okay, and the definitive difference was that turmeric was used in the diet more with people who did not, participants who did not have thyroid nodules. Now, the researchers in the summary of the study, they state that more research needs to be done to find out just how much turmeric should be taken every day. They could not, offer any advice whatsoever on how much should be used to prevent the occurrence of thyroid nodules. They only had a definitive resolve to maybe their initial hypothesis that turmeric use was associated with reduced goitrogenesis. So that's the first part of my research. Okay, and I gave you all the information on that study that you can go look up for yourself. After that, though, I couldn't just say, oh, well, I'm going to let my subscriber know that they should go find turmeric and start putting it into their food. That's ridiculous. I had to find something more definitive to tell you, okay? And in my search, I actually found an article published by a doctor of pharmacology by the name of Dr. Izabella Wentz. She published this article March 1st of 2018 in the name of it, thyroidpharmacist.com, okay? The title of the article is Turmeric for Your Thyroid and Hashimoto's Disease. And she offers so much wonderful, helpful information here about how turmeric can help thyroid disease. And I'm actually going to read directly from this, because if you are a sufferer, you might find this helpful as well. This particular part of the article is titled How Turmeric Can Help Hashimoto's. Excess inflammation is always present in Hashimoto's thyroiditis. The suffix itis denotes inflammation in the thyroid gland, and intestinal permeability has been found as a common factor in every case of autoimmunity. In some cases, people with Hashimoto's may also have heavy metal toxicity. Curcumin, the most studied active ingredient in turmeric, has been shown to have anti-inflammatory, antioxidant, antibacterial, and antiviral activity, all of which can provide benefits to those suffering from Hashimoto's related symptoms. Okay, now she offered a little diagram here. I don't know if you can see it. I'm going to read it out to you.